for today is Gail, who is a nephrology nurse of 36 years. I had to look at that like 3 times, Gail, because I could not believe that it is possible that I worked in the dialysis industry for 36 years. But indeed, every time I look, that's what it says. And you became a nurse because you wanted to teach people how to improve their health. And something that really touched my heart and really just resonated with me is that you have realized as a nurse that patients aren't always ready to listen until they're ready to listen and they're ready to learn. And that is, for a healthcare provider, sometimes it's a big hill to get over. And I'm glad that you're here today and that you are going to be able to share information with us. I think this is going to be a wonderful presentation. I'm all excited.
But first, I want to show you, I'm highlighting Laurie's painting that I got from her in the background here. Does everyone see it? It's called High Tea. It's 5 ladies and a kitty cat. And it's beautiful. And I'm so glad I bought that. And it was a nice donation to Renal Support Network, who I've been a fan of for many, many years. So thanks for joining today. Cher mentioned that I like to teach people about healthcare and improving their health. And I have to say, when I was in high school, I wanted to be a school teacher. And about the time I got out of high school, they were laying teachers off because back in those days, a lot of women took birth control pills and things like that. And so there weren't a lot of little kids around. And so I'm like, I want to be a teacher, but I don't want to go to college and not have a job. And so I had a friend at the time, his sister was in nursing school, and she said, Gail, you should be a nurse. Nurses do teaching all the time. And I didn't realize that. I thought nurses gave shots and nurses helped in the OR and emergency room. So anyway, I went into nursing, and lo and behold, I loved it. I loved it because of all the teaching, and I'm still consider myself a teacher. I do a lot of teaching with nurses and staff and also with patients. So I'm really glad to be here. And I hope that you can take home something today from this discussion. And I really mean that. It needs to be a discussion. I'm going to give you some ideas, and I want to hear your feedback in the chat or in the questions. And so I want to start off saying, if you're on dialysis, you get that monthly report card that might look perfect, but your body may not feel the same. And if you're a transplant patient or CKD patient that has a working kidney, it's the same thing. Your labs might look great, but you don't always feel that great. And that's because a lot of people with CKD have 9 to 10 symptoms or side effects that interfere with their life. And sometimes our healthcare team, and I could be one of them, isn't listening well enough. And so what you need is someone that listens and makes you feel like there's a chance that you have hope. And that's what Renal Support Network's all about, because they know your problems and they listen. And so please advocate for yourself with your healthcare teams. You need to tell them, and you're going to hear this repeatedly today, tell them your most difficult problem. You know, is it constipation? Is it shortness of breath, itchiness, depression, insomnia? What is it? So we want to live longer, but we don't want to live with these bad symptoms. So what are some of those for you? I'd love to hear that in the chat. I'm gonna start with some here. Anybody have problems with shortness of breath? Well, let me tell you, if you call me and I'm your nurse and you have shortness of breath and you're on dialysis, I'll say you probably have too much fluid on. But it also could be a heart problem, or maybe it's the medications you're taking, or maybe you're just anxious lately. There's some stressful things going on in your life, or maybe anemia, meaning a low red blood cell count. That can make you short of breath. So Is your blood pressure too low? Are your BP meds a problem? Some people need the blood pressure meds decreased. And so if you go in, you tell your doctor, my most worrisome problem is I'm so short of breath so often, then they need to look into that for you. Some nephrologists may want to lower or raise your dry weight. Your nurse practitioner or your PA may do the same thing. If that doesn't work, it's something else. If you do PD and you can't get fluid off, it could be trapped fluid, not necessarily in your lungs, but it's trapped in a third space. So you don't want to mess around if you're on PD and you get short of breath and you have excess fluid. So it's a good reason to call your doctor or your clinic nurse, or maybe even go to the emergency room. Maybe you need oxygen. You know, have you had your oxygen level tested? I bet if you go to the ER or if on the, and you'll have to tell me, transplant people here and Lori and share, you know, when you go in to have your a transplant exam, do they do a pulse oximeter testing on you? You know, it should be in the high 90s. And if you're running in the 80s or low 90s, maybe you need a little oxygen. And let's figure out what's causing that shortness of breath. Consider logging your symptoms and what you're doing at the time when you become short of breath. That's a really good thing to take in to your doctor and show them, or when they make rounds at dialysis. Again, tell your doctor your worst problem. My worst problem is shortness of breath. I feel like XYZ. And tell them, make them listen. Don't let them walk away and not respond. So what kind of, let's see, okay, so we got patients with drain pain and PD patients. And when I was on PD, I struggled with constipation and hypertension. Okay, so drain pain, when I talk to patients about that, what they tell me is sometimes they have to roll on another side if they're doing the nighttime drains, or stand up if it's during the day, standing up. Usually that means that your catheter is clinging up next to the abdominal wall or to the intestines, and that's causing pain. So some patients that have regular pain, especially if they're on the cycle or at night on PD, they have to do what's called tidal dialysis. The full amount does not drain, and so they don't get that final pull on that catheter up against that wall. So that's what I know about that. And we're going to talk about constipation a little bit here in a minute. Hypertension is usually a fluid or medication problem. Not as common a side effect as some of these others or symptoms that people deal with. Hypertension, though, can cause horrible headaches. It can cause a stroke. So you want to be very careful with hypertension and get that under control. Does anyone have any other things they want to say about shortness of breath? Anyone have shortness of breath? Could we see you raise your hand? I also wanted to talk about Renal Support Network's website. They have a video by Dr. Block that talks about, oh, sorry, wrong page. That comes later. Sometimes blood pressure goes down after we eat and might cause shortness of breath. So I heard a patient talking about that and wrote that down. And what they recommended for them was to try eating smaller meals. So if you're having that shortness of breath and your blood pressure drops after you eat, try eating smaller meals. And ask your nephrologist if you need to see a cardiologist or a heart doctor. You know, that's a common thing that can happen. So I see we have somebody with dry mouth, peripheral neuropathy. Okay. So let's talk about peripheral neuropathy. That can be caused from kidney disease, and it can be caused from diabetes. And that is when the nerves in the feet and hands become somewhat damaged, and you have like a tingling feeling. They make special shoes for that and socks, I believe, and there are some things that can be done. Acupuncture is something that I've tried for different joint pain and things like that. Um, I need to go back and try that again for a new problem I have, but you certainly can try that. I don't think it's harmful. I would let your nephrologist or nurse practitioner know that you're thinking about doing that to make sure they are okay with that. You would not want them to put the needles in at your access points or anywhere near your catheter if you have one in your chest. And if you're a kidney transplant patient, I would avoid that area where your kidney is transplanted, usually down in the lower abdomen. So just let them know your history so that they'll be careful and not interrupt any of those important spots on your body. Anyone else have ideas about peripheral neuropathy? What has helped you? We'd love to hear it. Let's see. Questions here. I'm considering, okay, so that's Carrie asking again. Okay, so, I didn't study neuropathy pain before I talked to you guys, but I'm going on what I know from the patients I've taken care of. So I know that, diabetes can cause that, and also uremic. If you were uremic for many years before you started dialysis or got your transplant. So that can be a problem. Dry mouth. Well, I'm not a CKD patient, but I have that problem, and I have turned to the Bioteam products that have helped with that, and a different toothpaste. I have mouth sensitivity, and so those things have helped. The Has anyone else used anything else? Using a hard candy is sometimes helpful for dry mouth. And if you're diabetic, you can get the sugar-free ones. So that's something that does help. I know the dietitians talk about dry mouth quite often because if sugar-free gum, Cher says, yes, thanks, Cher. But the dietitians I've worked with will try to help patients with dry mouth, because if you have that problem, you end up having it affects your appetite, doesn't it? You don't want to eat the healthy foods that are on your diet plan. So let's see, restless leg syndrome. That's another, that kind of goes along with insomnia. A lot of people that have insomnia get the restless leg syndrome. There is medication for that. It doesn't always work. And I'd love to hear what people have done for restless leg syndrome in the chat. So please add that in there. I think that can also be an anxiety problem. Again, that's just my off the cuff. I haven't researched that. And that was not one of the things on my list that I got prepared for. So I could use your help if you have had restless leg and found a cure for that. So let me talk about insomnia some, because I know insomnia affects a lot of people, people that aren't necessarily having problems with CKD, but for sure, people with CKD often have that problem. So no one can live without good sleep at night or whenever your sleep time is. And if you're struggling more than 3 nights a week, that's a real problem. So our body has an ebb and flow that's called a circadian rhythm, and it can if you become out of step, it causes insomnia and it makes life miserable. And I've been there before. There, again, I'm not a CKD patient, but this can happen to any of us. And it feels like terminal jet lag. You just never get over it. So there are lots of tools available for most of us to help relieve insomnia. Try making one change at a time to see if that works. It's all a trial and error, just like so many things. I know for me, I have to have a really comfy, cozy bedroom. So I like a nice warm blanket. I like a squishy pillow. I went to my daughter's a few weeks ago and she had a foam rubber pillow, and I said, nope, I can't sleep on that. So she found a squishy one. So buy the best you can afford of your linens and mattress, and dark window shades or blinds so that you have the light. The light is out of the room. And turn off your TV or limit that screen time. Maybe use one of those soundscape noise makers. They can have the sound of rain or crickets or a breeze blowing in the trees. A warm bath or shower sometimes is real helpful. And again, this may help your restless leg syndrome. Meditation helps many people. If you're into the alternative medicine, like our person that mentioned acupuncture, meditation is another one, along with aromatherapy. Also, there are sleep trackers like Fitbit, and they make all kinds of them. Some of them are $50, some of them are $500. So, you can pick the one that is affordable for you, and it helps you realize how much you're sleeping and if you're getting good sleep. I know I wore one of those for a while, and I couldn't believe when I'd get up every day and see how it was tracking my sleep. That I'm like, I knew I had a restless night, and it actually showed up on the sleep tracker. So if you're a woman like me, sometimes we have hormone imbalances, especially if we're over 50. So that dreaded menopause can cause that, and it does interrupt sleep. So talk to your doctor about that. Some doctors may refer you to a hormone specialist to have that tested and see if that would help you. If you're also having insomnia, try avoiding daily naps or even sleeping while you're on dialysis. I know it just seems like the thing to do, but if you try to stay awake, you might be able to sleep better at night. Maybe changing eating habits would help too. Less sugar, less carbs late in the day, so your tummy isn't churning and trying to digest. And if you can, exercise to work your muscles and tire them out. Tune into our exercise guru Adina's program and the other person that's on Tuesday and Thursday. Some people on dialysis are not getting a lot of toxins removed, which keeps them in a uremic state. So if you've had to cut your treatment short or have had to skip treatment, that can actually cause your BUN to be high, causing uremia, and that can keep you from sleeping. A lot of people ask about melatonin. And melatonin, I would, of course, ask your doctor if you can take that. Sometimes that helps people. Many people, it does not help, but it doesn't hurt to try it. CBD is also another over-the-counter type of supplement we can try taking. I know that I tried some of that oil that I took before I went to bed. It did help me have a more restful sleep for a couple of months while I was having trouble sleeping. And I don't know if Lori will agree with me, but if you're in a state that has medical marijuana, ask for a medical card so that you can purchase that if you really need it. That really does help some people. If you're in a non-legal state, you're not going to be able to do that, but you can try the CBD. What about those people that have sleep apnea? Is that you? Sometimes I worry about that with myself, and so I thought about having a sleep study. If you think you would need that, I would ask your doctor if you could have a sleep study, because sometimes that detects problems that are not related to kidney disease. And last but not least, prescription sleeping meds. Nephrologists and nurse practitioners, PAs, like to give you an easy fix for your problem. And so they might recommend a sleeping pill, and that's fine. I would ask you to try and do some other things first before taking another medication, because you're on enough medications, right? Most dialysis patients are on like 10 meds, and transplant patients probably no different. So prescription meds are there if we need them, but please try other things first. And if you have just horrible symptoms and you've tried everything, let your healthcare team know that this is my most worrisome problem. This is making my life miserable. Please help me figure out what to do about my sleeping problem. So again, advocating for yourself. So share, what have we got people in here asking about? Or Lori, either one of you.
Okay, very good. Hold on just a second. Let me see if I can figure out my controls over here. All right,
Oh, I do. Oh,
super.
go
Okay,
ahead.
I think this was for your presentation. Someone is having issues with nose bleeding with no solution from the doctors. Do you have any experience with that?
I do, and it just seems like patients come and go with that. I've had friends that have had to have cauterizations and everything. So, um, it, when you're having a run of nosebleeds, if you're on dialysis, you need to let your staff know, because they need to possibly cut back on the heparin they give you that prevents your blood from clotting when it's in the artificial kidney. So that's what I always did for my patients, is cut back on the heparin, or try to just flush the kidney every half an hour with a little bit of saline to make sure you're not clotting. That is a big problem. You can lose a lot of blood with nosebleeds. Oftentimes it has to do with hypertension and that system. So it's not something you want to ignore. Please let your healthcare providers know about that.
And they might
I
even
know
need
that's not a,
right? I mean,
go
you
ahead.
can't get a tumor in your nose. You can have a chronic sinus infection that it might not be related
Absolutely.
to dialysis directly, but rather indirectly, right?
Right.
Okay, super,
Absolutely.
super.
Right.
So, what kind of advice, because, I moderate many of the support groups that we have, and a common question that we have is that whenever someone is brand new to dialysis, what are the things that they should be asking before they start and then after they start?
Asking the healthcare team.
Mhm.
Well, always you want to, if anybody that goes into a doctor for a problem, you want to find out what's causing the problem and ask them, what can I do to make it better? Do I need to exercise more? Do I need to cut back on fatty food? Do I need to watch my sugar foods? What is it I can do to help you solve my problem? If you expect the doctor to do everything, it's not realistic. So you have to be there to help. And what is the most important thing for me to do uh, to fix this problem? So if the doctor says, well, you have this high blood pressure and I'm going to start you on this medication, I want you to take your blood pressure twice a day, maybe when you get up in the morning, when you go to bed at night. The blood pressure cuffs that they sell at the pharmacy, they have some that are $25, and often you can get a coupon to get money off. So they're not $150 or anything like that. So learn how to take your blood pressure. and do what the doctor has asked for you to do. If he's asking for you to do 10 different things, then say which one is the most important. I can handle one at a time. There's no way they should ask you to do more than 5 different things, and what thing is the most important. So always have a clear understanding. A lot of times healthcare professionals don't use common words. They use words like, the itis at the end or osis at the end. And so, doctor, please explain to me what that means. Well, it means you have an infection in your lung. That's bronchitis, or something like that. I know that's very simplified, but we as healthcare providers can come up with these great big long words where, it's not understandable for your regular everyday person. And so some people, finished 6th grade, some people finished a PhD. But let me tell you, I've had PhD patients that needed just as much explaining on a layperson term than I did with people that maybe just got to high school. So it's not really a level of education. It's how you're talking to someone and how you're relating to them. If you can't relate to your doctor, hopefully they have a nurse practitioner to talk to, or maybe you need to choose a different doctor if that's possible. Does that help you share?
It does. If someone is, just starting dialysis and they're feeling sad, how do they tell the difference between, this is something that they can get over with in a couple of weeks, or if they need some help?
90% of patients that are new to dialysis, number one, they're very nervous, they're very anxious. Some are very depressed, some are very angry because they have lost part of their life. They have to come now 2 or 3 times a week, and they have to, it's like a part-time job. They have to be there. So they can have all of those feelings, and all of those feelings are normal. But what I always would tell them is, yes, we understand you feel really badly. Give it a month. Give it a month of treatments. That's 12 treatments, and we hope you'll feel better. And 90% of the time, those patients feel so much better in a month. I often heard people say, I didn't realize how bad I was feeling until I got dialysis and started feeling better. But you got to give it at least 1 month. I've also heard people say after a transplant, I never realized how bad I felt while I was on dialysis until I got a transplant. So, if I'm ever faced with that, I'm going to be trying to get on that transplant list, because I have people I know that have said that, and I always want to feel the best I can. So,
What if you're a patient and you're not happy with your current treatment modality and you think you want to try something else? Who do you talk to? Who do you approach about it?
well, anyone at your clinic should be able to talk about that. But I would for sure talk to my nurse. Um, it's required by our government that pays a lot of the bills for patients with CKD. It's required that you know all the modalities. They should have a pamphlet, or they should be able to explain it to you in a fair manner. Also, we have all these wonderful websites we can go to, Renal Support Network, Homes Dialysis Central, AAKP, American Association of Kidney Patients. We have all these wonderful groups. Also, our ESRD networks. Every patient in this country is under one of the networks, and that is posted in your lobby at your dialysis center. If you're a CKD or a transplant patient, ask your physician or your nurse at the office to refer you to those. And I'm sure that a lot of that's on the RSN website too, places to learn about. Home Dialysis Central has a a card that's the size of a piece of paper, and it's called Match D, and it talks about all the common pros and cons for home hemodialysis, peritoneal dialysis, nocturnal dialysis, and no dialysis. I think they even talk about you can choose no treatment but then you realize that you're not going to live much longer. So, but you do have those choices, and transplant. So transplant may not be on Match D because it's a transplant. It's not a therapy for dialysis, but you can find the others there. It's a really great tool that Dory Chattel and her team has come up with, and it really is helpful. If I have a nurse friend that was on dialysis, and she decided to do in-center dialysis, and I said, Jan, why did you choose in-center? You're a dialysis nurse. Why aren't you doing home therapy? She said, Gail, I just don't have room for all the boxes in the machine and all of this and that. And I bet some of you have to deal with that, and some of you struggle with that. So there are ways nowadays you can have deliveries every 2 weeks instead of monthly, and they try to work around it because we're trying to get patients at home. Home patients tend to have less symptoms of these symptoms we're talking about. They tend to be happier, and they actually, when you look at the statistics, they live a better quality of life. So it's a good thing to choose home dialysis if you can, and Match D is a place to look.
Gail, this is Lori. I love your presentation,
Yes.
and I have to tell you, I've been known to take a few gummies here and there because I live in California. I live in the state of California, and it's very common for CBD creams. I've used those for achy joints. It's eventually, I think the rest of the country will, but the gummies do help you sleep. I mean, if I have a problem, I can take one. And I thought it was really interesting because this is just relatively new, that's changed with CBD and different type of pain relievers. And thankfully, I hope other states join on, because we don't have access to pain meds like we used to. I mean, it's like an act of Congress to get anything for pain when you really need it. And hopefully the pendulum will swing in the middle. I wanted to come back a little bit and just maybe you could touch a little bit more on GI issues. This is one of the biggest issues with like I hear about people having GI issues, bowel obstructions. Is there a reason why people with kidney disease are more prone to these GI issues?
Well, in my opinion, it's all of the meds, and those binders can be a problem. I do want to say someone in the chat put something, low vitamin D might be related to restless legs. So, so thanks for putting that in there. But back to GI issues, the binders are oftentimes cause diarrhea or constipation, but they're a needed necessity to prevent the bone disease, which is a long-term problem, which also affects the heart and many areas of the body. So, you get calcium trapped in the muscle, in your muscles and in your heart. So when I looked up constipation and all the patients talking about constipation, most of them that said they were relieved by having a diet high in fiber, which means green leafy vegetables, fruits that are safe with potassium, like berries, grapes, and apples. And someone said oatmeal was a big help for them. So, using your diet is just the first place you should probably look for control. Now, if you're totally constipated this minute and you need to have, something to relieve that, then you're going to have to do something that is like over-the-counter Dulcolax suppository or orals, um, uh, uh, laxative. I couldn't think of the word. A small enema. You have to be really careful with enemas, but they make those fleet that are real small. And I had to have a surgery 4 or 5 years ago, and I was just taking that codeine every 4 hours for that surgical pain. And I got home and I thought I was going to die because I had not used the bathroom for 4 days. And so my husband had to run out, and that's what relieved. So if you really have an impaction or you feel like you're just not going to be able to sleep because of the pain and cramping, then you're going to need to get some relief immediately. I would always ask my doctor. For people on dialysis, you need to ask your doctor what is used, what I can use in a urgency like that. For long-term control, stool softeners, fiber supplements, Miralax is also something that can be taken every day or every other day. And what it does is it pulls fluid into the colon and it helps it soften so that it'll move along and be able to be eliminated. So I am not prescribing medications to anybody. You do need to ask your doctor, but there's a lactulose, and there's actually one that's over the counter, I'm told, that, or maybe not over the counter, but it has to be ordered. And some doctors, nephrologists, will order that, and that it works pretty quickly within a few hours. So I would ask about that. I wouldn't demand it because you want it to be safe for you. So coffee, some people just say smelling coffee and that makes them have to run to the bathroom. A couple other patients were talking about chia seed pudding. If you know what chia seeds are, they're little black beads and they absorb liquid if you make them in a pudding or put it in a yogurt. Again, that's all a dairy. So if it's a dairy product, you're going to need to take your binders with it. Normally, our dietitians don't want us, if we are on dialysis, they don't want us to have dried fruit because it's high in potassium. But a lot of patients have asked their dietitian if they can have 1 or 2 prunes a day to keep them going. Okay, so I know prunes aren't something that everybody loves, but if it kept me from having that horrible cramping and constipation, I think I could do that. So if you're on PD, you know that constipation can really affect the draining of the fluid. So it's really, really important that you prevent constipation and talk to your nurse about the best thing to do for that. And I think she'll recommend a lot of these things I'm talking about. And so if you have the binders that cause it, you need to let your family, let your doctor know that, this is the worst problem I have, is that I have, constipation. And it's really, really a problem. So you've got to find which binder works best for you. And it's a hunt and peck to find what works. But every binder works really great if you take it. For some people, it causes constipation. If it's one that causes constipation, try another one. If it's one that causes diarrhea, try another one. So there are lots and lots of laxatives out there or stool softeners that can help prevent. So Metamucil is not good for our patients on dialysis because you need to take it with a lot of fluid. So, a fluid restriction of 1,500 cc's or less a day doesn't allow you to take a lot of medications with a lot of fluid. So I would avoid the Metamucil.
Yeah.
Be sure to time any laxative. If you have a laxative that works in 8 hours and your dialysis is at 6 a.m., you don't want to take it at 11 o'clock at night. Okay, you want to take it at 6 p.m. or you want to take it at 4 p.m. So that before you go to bed, it will work for you. So just, be careful. with that. Some people with CKD say they have no constipation once they eat a plant-based diet. And I know our dietitian that was on here a couple hours ago was talking about a plant-based diet. So you might consider that, or eat less and less meat and eat more of a plant-based diet. If constipation is your biggest, most horrible problem, be sure to tell your nurse and doctor. Tell them you're frustrated with this problem and you need their help. If you ask for their help, that really hits them right in the heart, and they want to help you. So they'll want to talk to you more about your problem and what you've tried. So don't be ashamed. This is something we all have trouble with along the health continuum. So,
It's so weird.
is that good?
I think that was great. I did want to follow up with one thing, just in my own experience, is I've had a lot of surgeries and in my stomach area. And I've then, as a result, have had diverticulitis on several occasions. And I was kind of commiserating with my doctor because I have to make sure that I don't eat a lot of seeds or I got to be really careful on, some of my food choices. Like garlic is not my friend. And he said that he had a patient that was just admitted because they ate a bunch of blackberries, and all those little seeds got, like, if you as we age, our colon gets a little funky and it can get little pockets in it. And then, we've had a lot of surgery and scar tissues. So it kind of crams stuff with a kidney if you have a transplant, or if you don't have a transplant, or if you had one. There's a lot of scar tissue in your tummy. So it gets a little bit crammed. And so I've learned that, I need to stay at a good fluid balance. And when you're on dialysis, I learned that I was most at risk if I got too dry, or fluid was pulled too fast off of me. So you need to make sure that, that's why daily or, PD, when you're taking fluid off slower, is better on your, it's good on your brain. It helps your brain too, because when you pull a lot of fluid off your during an hour, it can actually cause some brain swelling, they've said, if it's too aggressive. But it also messes with your intravascular. So it's really important to talk to a dietitian to know what foods trigger
I agree.
you. I mean, if I eat popcorn, I do not eat the little kernel, because I can eat the popcorn, but not the little kernel. So I think this is important. And then somebody asked a question, what a binder is.
Oh, okay.
I know. I think that's an important one.
I love to talk about binders. So a binder is a pill that the doctor orders you to take when you eat. So you have to have food in your stomach in order for the binder to work. So let's say the binder is a calcium acetate, which is a very inexpensive, commonly ordered binder. So you take 2 capsules when you eat your breakfast, and you might take a few bites in your capsules and then the rest of your breakfast, or take it right after you've eaten it. Just the binder has to be in the stomach at the same time. If you take the binder a half an hour early, then the binder's down here and the food is up here. Or if you do it vice versa, you forget and you take your binder a half an hour after your food, then your binder's up here and the food's down in the intestine. So you want to take them at the same time. And what they do is they open up and the granules come out, and the granules bind to the phosphorus molecules that are in the food. And the foods high in phosphorus are any dairy product that has milk, or ice cream, yogurt. Eggs are not really considered a dairy. Those are a protein food, so not eggs, but those foods, your high phosphorus foods. Beans are high in phosphorus. Colas and Dr. Pepper and Hawaiian Punch, a lot of the liquids that or common things we drink are high in phosphorus, and they're the chemical type of phosphorus, not the organic type that's in beans and things like that. So someone mentioned here that they were told to eat white bread, white rice, and rice cereal, and not to have wheat or whole wheat. And that's because of phosphorus. And so, and that causes constipation too when you eat a lot of white rice and white bread. So no, it's best when you're on dialysis to not eat the whole wheat fibers, but a high fiber food would be your vegetables like broccoli, cauliflower, spinach, those types of things. Green beans are high in fiber. So we're not talking about grain fibers. We're talking more about vegetable fibers. So I think that answered your question, right, Lori?
I think you did.
Or the binders, is that enough
Yeah,
on
the
binders?
binders, somebody just asked what a binder is, and if you have a higher phosphorus, you just need to take them, because there's an old saying, if I'd known I was going to live this long, I would have taken better care of myself.
Yes.
As you know, right? It's so true. Well, thank you so much, Gail. I appreciate seeing one of my pieces of artwork there. Everybody,
Yes.
a great way to cope with anything is to be creative. And I mean,
That's right.
but thank you so much. And you always are so dedicated to people who have kidney disease. So
well, thank you.
Been doing
I
it for
always will be.
How long have you been doing this?
35 years.
Now you found
36 years.
You found 36 people to replace you, right?
Oh, I wish. I have a granddaughter going to nursing school and a second one that will start next year. So I have 2 people replacing.
That's okay. Well, you got to get up to every year that you've been in. That's your quota. Okay.
Thank you, Lori, for
Thank you so
having
much.
me.
All right, Gail.
Good. Thank you, everyone.
And a shout out to our corporate mission partners for making this happen.